Ladies and gentlemen, it is your boy Javi. I am back from St. Mary's Long Beach Medical Center. It's been a crazy week. Went into surgery Monday morning at 7:30 a.m. Right now I look a little tired as pain medication has been rubbing off. I've actually been taking some sort of Tylenol elixir syrup, and typically it works, but as I've been back it's not working too well, so I'm feeling a little weak. I'm also taking this type of anti-acid. It's called ranitidine or something like that. That's for any type of ulcers and just help with healing in the stomach. Having some lower abdominal pain as well, but overall just feeling great. If there's a secret I can truly give to any gastric bypass or bariatric patient is listen to what the doctors on what they say when it comes to exercise. I believe that I've learned this because the first time around 7 years ago when I had the regular gastric bypass surgery, I did not listen, and when they would tell me to walk, I would not walk. And you know what happens is you end up stiff, you end up really sore, you end up crinkling up. But when you walk, it just does a massive difference. And it's like a super medicine. It's like a super drug, a super pain reliever. And yeah, walking does a massive difference. You can ask any of my doctors, any of my nurses. They were trying to get me to stop walking this time around, and I just kept walking because the more I walked, the better I felt, the less sore I felt. I will say that the CO2 gas was very painful. That to me was a lot more painful than the actual surgery itself, than the actual incisions itself. It was very painful. As I'm back here at home, they've obviously given me some drugs to take home. They've also left me with this drain tube. This has actually it was emptied this morning before I left the hospital. And I have to be emptying it again, and I believe they're actually going to be taking it out on Monday. Also, what's really cool about my hospital is that they're sending a nurse to come and see me soon. So that's actually really awesome. Kind of excited to see the nurse and kind of just tell her how I feel. I feel a little sore in my abdomen, and obviously going to let them know that the pain meds isn't really working as well as far as my internal pain and things like that. But overall, what has been helping me the most is not the medicine, it's the walking. The walking has done a massive difference. If you're considering bariatric surgery and you get it, know that the first day is the most pain you're going to feel. But the more that you walk in that day, the less pain you'll feel. You know, obviously when you're at the hospital, ask the nurses to go with you for walks, especially when you get in pain. Also know that there is powerful medicine that will help you. You know, maybe 3 milligrams of morphine will definitely do a change. Because when they gave me 3 milligrams of morphine, it definitely put me to sleep and just made everything painless. Now, as far as portion size and foods, what I've had so far, I've had a little bit of pudding, I've had some cream of wheat, just trying a little bit of things, a little bit of potato soup. Also, I've been on the chicken broth, clear liquids, water. But this is pretty much my portion size, what I'm noticing. I have a lot of trouble right now drinking this little 30 milligram cup, which is pretty much 1 ounce of water. I definitely can't chug this, because if I were to chug this, it'd be way too much. So I've pretty much have lost about two pounds already. I will be posting some more updates. Thank you guys for tuning in. I would ask you guys to keep me in prayer. Thank you guys so much, and I will be updating you guys on some more of this radical, rapid weight loss. Thank you guys so much. My name is Javi. Make sure to subscribe, and God bless you guys. Take care.